Vaccine prices need to be capped in high-income countries such as the US to prevent low and middle-income countries being financially outcompeted, as illustrated through Figure 1. A repeat of the unrealistic COVAX scheme is not the solution. COVAX's vaccine supply is unreliable and unpredictable, as high-income countries securing advanced orders hinders poorer nations planning vaccine programs in advance. Populations will be hesitant to be vaccinated if they can't access vaccines conveniently, but until at least 70% of the global population is vaccinated, pandemics won't end, as mutations against vaccines would arise and completely undermine global vaccine efforts.
Not everyone has the privilege of being able to take time off work to recover from vaccine symptoms. In the vaccine rollout, those who need it most, casual workers, zero-contract part-timers, sole traders, and contractors get left behind. Individuals are left to choose between maintaining their income and protecting themselves. Research by the Kaiser Family Foundation in the US has showed higher levels of vaccination in those who were offered paid leave to recover from symptoms of the COVID-19 vaccine and those who weren't. There is also a correlation between communities who work hourly in-person jobs and lower vaccine uptake. These communities are also at a higher risk of becoming a COVID-19 hotspot. To combat this, a firm-managed solution funded by state or federal government, firms gather employees who are willing to get vaccinated and arrange a schedule, one that maximizes business operation and number of employees getting vaccinated. Individuals are allocated a set number of consecutive days, for example, 2 days, and are reimbursed for work loss due to recovery based on one of three systems. They can be reimbursed partially or fully of expected income loss or at a flat rate. The funding system is dependent on the government's capability. It is essential that this program maintains simplicity, otherwise it would be counterintuitive. Government policy is not the only way politicians can help.
Political factors have been observed to be another leading factor which influence COVID vaccine uptake. An Australian study by Smith and others found Australians show higher hesitancy about COVID vaccine than other general vaccines. Recent studies also indicated a lack of confidence in government intervention, and a perception of COVID vaccine was being developed for political reasons helps explain an increase in hesitancy. Whereas older participants and government supporters are more likely to be vaccinated. Correspondingly, effective pandemic control and government intervention is key to increase COVID vaccine uptake.
Religious beliefs are also another contributing factor. Some religious communities prefer alternative approaches such as religious teachings and holy water over vaccines. This is due to a combination of the limited knowledge and understanding, leading to misinformation and negative perceptions, so there can be some confusion as to whether the vaccines does abide by their beliefs. One of the solutions regarding the political and religious factors is a possible collaboration between health professionals with the political and religious leaders using motivational interviewing. Motivational interviewing has been shown to be effective in reducing vaccination hesitancy. It involves empathy, reflective listening to address uncertainties and promote self-change. As the leaders have a big influence on their communities, the messages passed on by them can promote vaccine uptake in their people.
A large deterrent in whether people get the vaccine is conspiracies. A conspiracy theory is an explanation which claims a certain event is controlled by powerful, sinister groups. For example, people could say the vaccine tracks you, causes autism, or it will give you cancer. While these appear to be outrageous, through repetitious exposure on social media, large amounts of people grow to believe these things and resist vaccination. So how do we combat this? Well, there are two methods. Firstly, we can provide people with counter-arguments to allow them to navigate around the rumors. Or secondly, ensure regular government-endorsed messages which stress the importance of trusting them rather than social media.
In the context of COVID-19, people are commonly uninformed about vaccine side effects and composition, healthcare research and statistics, and vaccine approval process and intentions. Such misconceptions arise from poor health literacy. Thus, equipping people with accurate contemporary health knowledge is the most pertinent solution. In general, those who can't access health information and medical statistics have poorer health literacy, which are usually older adults and culturally isolated groups.
Culturally isolated groups prefer online communities. We propose collaborating with fact-checking agencies and social media platforms to identify and tackle fake news, cooperating with scientists to educate. We would reach less tech-savvy older adults through in-person dialogue with health education specialists, who can deliver accurate information with positive reception, while also broadcasting them on TV and radio. We would ask community gatekeepers to help recruit and snowballing participants using incentives like free physical exams and grocery coupons.